I'm Dr. Tama Cathers, small animal veterinarian, and today I'd like to go over more about what coronary microvascular disorders are. I'm coming from an educated patient perspective, not a medical professional in the field. I'm a small animal veterinarian with one of these disorders. I'm not an interventional cardiologist with a specialty in microvascular disorders. So this is a shallow dive, but hopefully it will be helpful for many people out there. Let me go over some terminology. In the medical world, heart pain is called angina. Coronary is heart, and microvascular means the small vessels, usually less than 0.5 millimeter in diameter. An angiogram is a study to look at vessels. Microvascular angina means heart pain due to the small vessel disorders that we're discussing today. The typical chest pain that we think of, which is exactly the same sort of chest pain that you can get from large vessels that are obstructed, or the typical coronary artery disease that we think of as causing heart attacks. Briefly, some anatomy. When we talk about the heart and its blood vessels, we're usually thinking of the large vessels that come from the heart to feed the body. For example, these vessels would go to the leg muscles and could provide the leg muscles with more blood and therefore more oxygen when you exercise. Just like other muscles in the body, the heart is a muscle. And when we exercise, our heart muscle itself needs more blood to get the oxygen it needs. The vessels that serve the heart itself are called the coronary vessels. We're primarily talking about coronary arteries in this instance. Usually, doctors look at angina in terms of finding blockages in the large arteries of the heart. These are usually the fatty plaques that we hear about. If they find those, treatment follows, including medication, stents, and bypass surgery. All this usually starts when a person visits the ER with chest pain. They get a series of tests to look for heart attack. And this includes an ECG, some lab work including troponins, possibly a chest x-ray. If these tests support a blockage in the large arteries, those patients will go on for a test to look for those obstructions. Oftentimes, this is a standard angiogram. There are other tests like MRIs and CTs that can look for this as well. However, this standard angiogram can only look at the big vessels. It can't see the small vessels. Imagine a tree with branches. It has big branches and it has smaller and smaller branches ending in twigs and leaves. The standard angiogram can look for the trunk and the large branches, but it requires a special test to see those smaller branches, twigs, and leaves. Nearly half of all the coronary angiograms show no blockages in the vessels. Sometimes this is because it's not a heart-related problem. Instead, it's something not related to the heart. But sometimes it's because these genuine symptoms are caused by the small vessels, microvascular angina. Microvascular angina is not rare, but it's often under-recognized and underdiagnosed. And that's because you can't see any of the vessels on standard tests. You still need those standard tests to rule out a heart attack or other large heart problem. But if your tests come back negative, that doesn't mean you don't have genuine symptoms. You just need more tests. Large artery obstruction is called coronary artery disease, or CAD. And now for a very shallow dive into the pathophysiology. Patho means things aren't going right, and physiology means how things are supposed to go. So this is a section on how things are not going right. In microvascular disorders, the small vessels of the heart can fail to dilate, therefore not letting as much blood through. The vessels can be thickened, or the vessels can already be dilated at rest to near or at their full capacity. When you exercise, your body needs more blood, and therefore your heart also needs more blood to do the work to pump it. Imagine that difference between at rest and when you're exercising is a dial. At rest, it should be set as 0, but you should be able to turn it up to 10 and get more blood flow. But in this case, the dial is already set on 5 or 8. This is what I have. This amount of extra blood flow is called the coronary flow reserve. I don't have much of this. Another thing that can happen, the small vessels can constrict and go into spasm. I think I have a little bit of this. So that's it for pathophysiology in this video. Microvascular disorders are one entity under an umbrella term of ischemic, non-obstructive coronary artery problems, or INOCA, I-N-O-C-A. This means that there's restricted blood flow to the heart, but it's not due to fatty plaques blocking the large arteries or coronary artery disease, what we have up until now thought as the main cause of angina. Microvascular angina is a variable condition. You can have short episodes or longer episodes, like my 2 months earlier this spring. The pain can be mild, is a hard word to say, but mild versus really severe. This disease has been historically an enigma, hard to diagnose and hard to treat. It's been given names like cardiac syndrome X. It's not benign either. Research shows that people like me with microvascular disorders are more likely to be hospitalized, experience a heart attack, or even die. Pathways to diagnosis. Before I go further, let me say, if you have chest pain, you should go to the ER. They're going to do the array of tests that you need to screen for a heart attack, and these tests will get you started on your pathway to diagnosis. Your care team should include your primary physician and a secondary care team, including a cardiologist. My path to diagnosis took 20 to 30 months. Be prepared to advocate for yourself and keep asking for the tests that you need, even if you don't know what these are. Tests to look at the small vessels of the heart include a special heart cath and angiogram. In this procedure, a small guide wire is passed through an artery in your arm or groin and into the coronary artery in order to measure the function of the vessels feeding the heart. During this, a chemical is used to challenge the heart and to see how it responds. A provocation challenge may be conducted at the same time as this heart cath, or you may need to be referred to this as a second test. This helps test for coronary vessel spasms. New advances in MRI and PET scans can allow the vessels of the heart to be imaged. These are non-invasive. They may also use gadolinium as a contrast agent or require a higher dose of radiation. There are also some non-invasive tests being developed and tested right now. I don't know as much about these tests, their pros and cons or accuracy. I recommend that you read up on any test that you're thinking of having scheduled, as nothing in life is benign. As far as I know right now, the provocation angiogram is the gold standard for diagnosing coronary microvascular issues. There are very few hospitals that can do these tests, probably 15 to 20 in the United States. The Microvascular Network on the internet has a website with an interactive map that lists doctors in the United States. And INOCA International has a site where you can find doctors in Europe. Pain from small blood vessel issues to the heart can occur with coronary artery disease, so you can still have obstruction in your large vessels or even a heart attack and still have undiagnosed microvascular disease. Coronary microvascular disorders occur in men and women, but a higher proportion of women have it. Some research shows that hormones can affect the function of the small vessels in the heart. Many women experience their first symptoms at menopause or afterwards. On a brief side subject, 70% of the people with microvascular disorders also have heart failure, generally HFpEF, or heart failure with preserved ejection fraction. This is when the amount of blood the heart is pumping out and the heart function appear normal on tests, but the person still has signs of heart failure. That would be me with my weight gain and pitting edema. It's actually caused by a different condition, but they're related. Heart failure with preserved ejection fraction didn't sound too bad to me. At least it didn't sound terrible. But actually, it's not good. It's hard to find the survival rates from the literature because HFpEF is a large category diagnosis. It can be caused from a number of different causes or mechanisms, but they're all lumped together. The 5-year survival rates are somewhere approximately 20 to 75% of the people are dead in 5 years. I have this, and it's been the worst news of the bunch for me. It's changed my outlook on life And in a way, it's changed my outlook for the better. Symptoms of microvascular disorders. Each patient has a slightly different experience. The chest pain can be very severe and present like a heart attack. It can come from nowhere and literally stop you in your tracks. It can be associated with exercise, or it can happen at rest or random. It depends on the type of disorder you have. I have exercise-related and random attacks. Other symptoms are chest pain that feels like squeezing, pinching, tightness, or pressure. The pain can spread to the arms, the neck, the shoulder, the back, especially behind the shoulder blades, and even down to the stomach. Shortness of breath, even when sitting still, or slow recovery time. For example, I pant for a ridiculously long time after a small effort like coming up a few stairs, feeling nauseous, sweaty, clammy, or lightheaded. An impending sense of doom. Fatigue, or extreme fatigue that lasts for days sometimes. Other less common symptoms can be experienced. It's important to realize that these symptoms are not always related to the heart. It could be other things, so it's important to go get checked out. A small aside for coronary spasms. This is one of the types of disorders we talked about, where the artery goes into spasm and closes down. It can also be referred to as variant angina, Prince metal angina, or vasospastic angina. This usually happens on a more random basis or while at rest, often in the morning or evening. Generally, exercise is not affected. If a coronary spasm is severe enough or lasts for a long enough time, it can lead to a heart attack. These disorders may have triggers. Here are just a few of the triggers: stress, cold weather, an increase in activity, exercise, high emotions like anxiety or anger. Experiencing these symptoms for the first time, or if they're prolonged, can cause anxiety. Sometimes an angina episode can occur randomly or with no trigger. Yay, what fun! How are coronary microvascular disorders treated? Several of the articles said research is still ongoing. I think that means we don't really know for sure yet. At this point, we're lucky to have these disorders being recognized and diagnosed. That being said, there are some standard medication protocols that they use, and they can be very helpful. Each person and their medication routine will be tailored for their problems. This is because they might have different microvascular disorders, or they might have different combinations of microvascular disorders, or they might have microvascular disorders and regular old coronary artery disease. So everybody's unique. Mine is hard to treat because I don't have high enough blood pressure to tolerate much medication. Yay for not having high blood pressure. In addition, each person responds differently to the medication. I'm the classic case of this. I react differently to most medications, and I'm super sensitive. That being said, there's still medications that are used routinely. ACE inhibitors, or angiotensin converting enzymes, beta blockers, and calcium channel blockers. These give a degree of symptom relief based on what the disorder is. People are put on other medications to help with overall heart health. These include statins to reduce cholesterol, sodium glucose cotransporters like Farxiga or Jardiance. These medications, developed to control sugar in diabetics, reduce hospitalizations and improve the quality of life for people with microvascular disorders. Other drugs of note, which may or may not be used depending on the individual, include low-dose aspirin, hormones, estrogen, nitrates. Coronary spasms are usually quickly resolved with nitrates. This worked for me. Women with reduced levels of hormones are often offered hormone replacement therapy. It can benefit some women, but it's not a proven treatment, and it's not recommended in all cases. Family history plays a large role in this. Since I was already on hormone replacement therapy, I'm not going off of it. As you can see, it's important to consider a wide number of risks before adopting a new medication protocol. And that's where your cardiologist and physician will come in. The recommendations will come from them. Doctors will also recommend lifestyle changes, as these can be a contributing factor, and addressing these can reduce symptoms. Smoking, for example, damages the lining of the blood vessels, and quitting smoking can bring symptom relief. There's all the regular: eat a healthy diet, do exercise that you enjoy, get enough sleep because that's important for all parts of our health, maintain a healthy weight, and reduce stress overall. Practicing yoga, meditation, breathing, tai chi, can actually reduce symptoms. For me, box breathing works the best. Box breathing is when you breathe in for a count of 4, hold the breath in for a count of 4, breathe out for a count of 4, and hold the breath out for a count of 4. If a count of 4 seems too long, count faster or use a lower count. Just keep the pace and rhythm the same. Doing this can help my angina, even in the middle of an episode. As you can see, your cardiologist and physician will have to look at a large range of risk factors to tailor a medication program for an individual. Let me end with a disclaimer. None of this should be considered medical advice or medical recommendations. The information presented is opinion only. I'm offering it in hopes that it will be helpful to people and of interest to medical professionals that haven't heard of microvascular disorders. Always consult your doctor before trying new medication or therapies. And if you have chest pain, go to the ER. I hope that you'll like, share, and follow me. Until next time, be well.